Hello, it's Patricia here, and I just wanted to preview some of the techniques I'm going to be teaching on our trauma-informed practice course. Now, this is the course that we're doing together, where I'm going to be taking you through how to become a trauma-informed practitioner. And as part of that course, we need to teach you some of the techniques that you will be using with your clients, because this is not just the theory, it's about being able to ground your clients in the present moment. And so what I wanted to cover actually in this absolutely essential understanding are some of the really brand new ideas about vagal toning, about using somatics, i.e. the body, to help people come into a grounded space of their own experience. And some of the techniques I'm going to be covering are ones that you do as a practitioner, things like EMDR, eye movement desensitization and reprocessing, has a rather long name, hence we shorten it to EMDR. I'm going to be explaining a little bit about how I think that works, because I think the understanding is gradually changing. And EFT, or tapping, emotional freedom technique, which can also be used as a self-help technique. And I'll be demoing some of the differences there with how I do it compared to maybe how you'll have seen it online, because there are variations, obviously, in how these things are approached. Now, for EMDR, you do need to be professionally trained, but as a UK person, you can do that reasonably efficiently. If you're in other countries, it may be a longer training. And certainly in the US, you need to be licensed. So it's certainly something to be aware of, but may not be something you'll use. So we need some other practical tools that don't enable you to retrain, don't expect you to go and buy another full course or training. What can you do in clinic with clients who are maybe showing signs of dysregulation? Well, one of the first things that we can do is vagal breath work. And the breath is one of the few places where we can intervene. We can be both involuntary and voluntary. So you don't normally think about your breath, it's an involuntary action, but you can, if you choose to, focus on the breath and change some of the balancing of the in and out breath. And there are some other techniques, some been developed by my mentor, Peter Levine, and other people have been looking at breath work as well. And I'm going to be going through some of the simple techniques that you can use. There are also some other ways of accessing the vagus nerve besides the breath. The ears are peculiarly, well, when you look at the anatomy, you'll understand why. But they link very much to the vagus nerve, which runs down from the back of your brain, but it's accessible from the interior down the side of your neck and down into the body. And so I'll be demoing some of the differences with certain ear movements. We'll be looking at cranial techniques as well, and explaining how simple eye movements can also be used as a basic vagal calming device. And that's using some of the work of Stanley Rosenberg, whose book, Accessing the Power of the Vagus Nerve, I'm going to be referring to, because it's a classic of its genre. Then we'll be covering sound and vibration, looking at sound healing, and why I think that works in certain ways, and frequency modulation, sometimes also called binaural beats, or holosync, is a very, very clever approach, which you can actually access without having to spend anything. You can find some very simple pre-recorded audios to give to your client for maybe between session support. And we're also going to be covering some of the touch-based interventions, things like the self-soothing of havening, which is a self-help technique. I'm going to be very clear about what that is and what that isn't in the session, and ways of also varying that. The variations are somewhat useful for people who may find this kind of stroking to be somewhat triggering. So we'll look at the variations of that. And then towards the end, we'll be diving into some of the more modern tech-based solutions and digital wearables, for instance. I've got one here, but there are various different devices, some of which are handheld, some of which fit on the head, and some actually wear as a pendant around your neck. So there are many, many different ways of bringing clients into regulation, and this is really important if you're going to do anything with them. So I can't wait to teach you some of that, and also to describe something that I've observed with people when they make that shift internally, that what I call ka-ching moment. And I don't want to give too much away, obviously, because you've got to attend to find out. But there's a way of checking in and actually having a conversation with your client's unconscious mind. And this, I think, is really essential to understand that you are not just changing their kind of conscious experience, you're actually talking to parts of their brain that they themselves are not aware of. So this stuff is liquid gold. Honestly, if you want to find out more, please sign up. You will find the course covers material that isn't covered anywhere else. And I'll look forward to seeing you on our extended module on the somatic trauma release techniques and vagal toning. I'll see you there. Take care, everyone. Bye for now.